Shani, I think you're on.
She's muted.
You're muted.
We'll give Shani a second. Shani was going to introduce us, but she just needs a tech minute. Thank you, everybody, for coming. We wish we could see your faces. Maybe at some other point later we will be able to. We'll talk about that in a minute. Okay, I'll introduce for now, and then Shani will introduce herself when she gets sound. We are really excited to be here to talk to you about this very important topic, which we know is really affecting so many women in across the globe, and of course Jewish women as well. And we know that there are lots of questions. You know, cancer diagnosis is something that is challenging, obviously, physically, emotionally, and spiritually. And when you're dealing with a whole world of halacha as well, there can be a lot of questions in that area. A woman is diagnosed, and all of a sudden there are so many different things that come together. It can be very overwhelming. And as Yoatzot Halacha, we want to be there. We want to help. I'm here as somebody that this year, Sharsheret actually had a training program that they started, that they are really planning to broaden. They're trying to train women among many denominations, really, eventually to be more prepared to help women that are going through cancer from this religious, spiritual perspective. Sharsheret already does a ton, but now they're trying to really and have an opportunity to help guide women and to tell them which Yoatzot Halacha they can call. Yes, Shani, I think you're back. I'll just finish my sentence. So again, this past winter, we had the first training program where I worked very closely with Melissa Rosen from Sharsheret and Rabbi Alman, who is the Dean of Nishmat in the United States, to help prepare other Yoatzot Halacha so that we can really be here for you, so that we can really answer whatever questions you might have with good, knowledge, with halacha, with understanding, with a little bit of understanding of what you're going through medically, and that's why we're here. Shani, you want to take over?
Well, thank you, Hinzi, and I thank all of you for joining us on this Pesach Sheni. Shavua Tov to everyone. And as Hinzi beautifully mentions, after undergoing the course, and we realized that as part of this annual Women's Health and Halacha Conference, that we wanted to address this very sensitive topic of breast cancer and halacha, recognizing how many different halachot really do come up together, though, with medical issues, concerns, questions. And even though we can't see you, I also am privileged to be here in London right now with a live audience. I hope we'll also participate. And just quick introductions. As a Yoatzot Halacha, I was part of the first cohort of Nishmat Yoatzot Halacha program, in addition to having the wonderful zchut to be able to teach issues of women's health and halacha, different courses in Taharat HaMishpacha. And on a very personal level, 7 years ago, I was diagnosed with breast cancer. And immediately, I wanted I say that's safer, or I wanted a conference like this to be able to ask the numerous halacha questions that came up, many of which I hope that you bring up on your own. If not, we've compiled various slides to help encourage asking the questions. So without further ado, I'd like to now introduce our medical consultant, Rachel Rabinowitz, a wonderful friend and oncologist. Rachel, all yours.
So just a couple words about me. I'm a professor of radiation oncology at the University of Colorado. I have also been a student of Yoatzot Halacha Shani Tarragon. Aside from being involved in breast cancer research and care for about 30 years, I am also someone who has been treated for breast cancer. So I really understand it from both the professional side as well as the personal side. And we look forward to addressing any questions that you might have, and we have some information that we can share with you. Do you want me to give an overview now, or have we not yet introduced Hindi?
Well, I kind of introduced myself. I'm Hindi Fader.
All right. Hi.
You can start.
And Hindi is also a Yoatzot Halacha who's with us this morning. or afternoon. Okay, so I'll just introduce just a couple of broad general ideas from the medical end of breast cancer. Medicine changes very quickly, and I can tell you that breast cancer care has changed dramatically in the 30 years that I've been practicing. Perhaps, Hindi, if you can bring up, I have one slide that just gives just the very generalities of treatment of therapies, of breast cancer therapies, not that one, I think it's above or below, there it is. So we divide cancer therapy into two categories. We call them local therapies, which deal with specific areas of the body, surgery and radiation therapy. I specifically am a radiation oncologist, so I design and prescribe radiation treatment when appropriate or when it's an option for a patient. And then we have systemic therapies, which mean these are therapies that enter the bloodstream somehow, either through an infusion by putting an intravenous into a patient, or by swallowing a pill, or by an injection. And these can be chemotherapy, immunotherapy, or anti-estrogen therapy. And because breast cancer is 1,000 different diseases and we stage them from 0 through 4, there's no one way to treat breast cancer, and it really depends on a lot of specifics. So other than saying that surgery is always used in the curative setting, these may be prescribed in any combination of therapies. And I think one of the scenarios we wanted to just start with is that when any woman is diagnosed with breast cancer, one of the first things her oncologist will tell her is that if she's on any birth control pills, any oral contraception, she should stop those right away because those are estrogenic. Those are estrogen treatments. And or if you're on hormone replacement therapy, you need to stop your hormone replacement therapy. And that can produce a whole number of halachic, social, physical, and other issues. So I will pause there. And
I just want to say, just because Rachel just perfectly segued us into a question that we had prepared, we're going to start with that. I just put the question on the screen. But what we really want to do here this afternoon is hear from you. These slides are a backup. We would much prefer to hear you ask questions, and there are two ways you can do that. You can put your questions into the chat, into the, I don't know, I think it's called room chat. Yes. Or alternatively, you can raise your hand. I believe perhaps at the top of your screen, there's a little icon. And if you raise your hand, we will bring you into the room. You can show your face if you feel like it, or you can just use your voice and block the video. We would love to hear from you either way. So we'll start with a prepared question just to give you a minute to think about it. But please write questions in the chat or raise your hand, and we will bring you into the room so that you can orally ask the question for us. I'll just read this first question that I put up on the screen. I was just diagnosed with estrogen-sensitive breast cancer and was told I must stop taking estrogen, birth control pills, but must also not get pregnant. What are my halachic options? So I'm going to turn to Shani, who's going to give us a little bit of an overview of those options.
Excellent. Thank you, Hindi. And the reason why we brought this up as the first slide as well is in order to take us through some of the stages of the diagnosis. And this should hopefully, as Hindi mentioned, encourage further questioning. So as we know, and especially because of issues of v'nishmartem ma'od lenafshotechem, we have a halachic imperative to ensure taking care of our health. And if this means, for the time being, not getting pregnant, then we certainly take that into account of also making sure that we don't do anything, for example, taking estrogen, which is just going to further trigger, as we know, the growth of the cancer cells. And therefore, halachically, the best way to prevent conception and at the same time as ensuring that there isn't shechvat zera levatala, that the seed doesn't go to waste, and at the same time that sexual relations still occur, what are known as kidarka, in their normal, natural manner. The next best method, so to speak, of halachic birth control is the insertion of an IUD, of an intrauterine device, ideally the copper, which we know has some of the least side effects. And this would mean also not a Mirena, meaning a non-hormonal IUD that is put in, which enables a woman, and as we know, to continue to have her normal natural cycle of menses. Sometimes this will also be accompanied by taking Leukerin, which will suspend her some of the hormones and the ovaries as well while she inserts the IUD. We know that if she doesn't have time necessarily before, let's say, surgery or before the beginning of chemotherapy, then the next best option is to use temporary methods of birth control, recognizing that they're temporary methods, which would mean even a sponge with a spermicide, or at times, and this obviously is a reason to consult with one's halachic authority as well, at times, even if it's for a short amount of time, and perhaps a condom. But the best would really be, in order of preference, the IUD, if one has time also to get fitted for a diaphragm, which has become more and more difficult these days, then that's also an option, not as an ideal as the IUD by virtue of the fact that the IUD allows for complete kedarka. The semen goes straight through the uterus. Still a machloket today whether in fact it prevents fertilization or implantation. And after that, all the other methods of temporary birth control. Okay, we hope that gave you some time for Anna for further questioning.
I hope you can see where you can raise your hand. If you're brave enough, we would love to hear directly from you. If you can, again, I can't see it from my side. But if you can raise your hand or even write in the chat, then we can bring you on to the screen to ask a question. We would really love to hear from you.
Right. And in the room chat, if you'd like to be anonymous, you're more than welcome just to ask your question, and we don't have to mention your name, and we can just ask the question and address it there.
They might see the name, but.
Oh, okay. Sorry, didn't realize.
The name, we can still be, a little more shy. Okay, well, we'll move on. I'm going to move on to another question, but please, we want to hear your questions. So keep in mind that I'm going to move on to the next question just for the sake of, not sitting here awkwardly, but we really want to hear from you. Okay, so the next question that I'm going to ask, and this is not in a particular order, just a question. This is a question that comes up a lot. I guess that's the order that it's in. There are times throughout the cancer experience that a woman may be in nida. While certain treatments affect the cycle and eventually could lead to hopefully temporary or an early menopause, there are times where a woman will be in nida. And the question that we wrote here is specifically a woman who's having surgery. I'm having a mastectomy next week. I'll be in nida. I don't know how I'll manage without my husband's help. What do I do about harchakos? And this, of course, is a question that comes up and is a true challenge. It can be really, there's enough that the patient is dealing with. It's truly a difficult time. And we want, obviously the woman needs care. That is a priority to make sure that she's cared for. But the question is, halachically, what do we do when there needs to be some separation between the husband and wife at this time? So I'll answer, and then maybe if Shani wants to add anything, she'll jump in. In general, there is some debate on this issue among the poskim, and the debate kind of follows the fact that the Shulchan Aruch and the Ramah debate this issue. So Sfardim are sometimes more machmir like the Shulchan Aruch. The Shulchan Aruch says that a man cannot touch his wife to help her while she's in nida and she's sick. Now, of course, he says he can't touch her, which does leave room to be lenient on other harchakot. That means things that don't involve direct touch, passing her things, preparing, other things for her. There is some room with leniency. He can help her in other ways, but direct touch, according to the Shulchan Aruch, should be avoided. Many of us who are Ashkenaz follow the Ramah, and the Ramah here is more lenient, in fact. And the Ramah basically says that a husband can do whatever is necessary to help his wife if there's no one else available. Now, that's a tricky sentence. If there's no one else available, what does that even mean? The question of asking somebody where it might be awkward or might be uncomfortable. You prefer your spouse to help you. Should you hire help? These are all questions that are discussed within the poskim. And again, there's some room for debate about the issues. Our posek in the U.S., the Nishmat U.S. posek, Rabbi Kenneth Auman, says that if it is difficult to get help, if it would be a financial burden to hire somebody, and if it would be uncomfortable to ask for help, the husband can help. The only things to keep in mind are that we're particularly careful about washing For different reasons, washing is considered a special thing that is in the old days. Today we shower, but in the old days, people used to help each other wash. That was considered very, very intimate. So the Ramah says to be particularly careful if you can about not washing the other person, but sometimes you can't. Sometimes that's part of the care that's necessary. And then the Ramah again says if there's no one to help, the husband can do whatever is necessary. The one thing that needs to be added is that many, many poskim say that if the husband is going to help, he should wear gloves. It's like, I know that might be emotionally challenging, but that barrier hopefully can just be a reminder of the deep love between the couple. Instead of looking at it as an upsetting thing, you love each other, it's emotional when you touch each other. There should be some sort of boundary. So again, according to the Ramah and many poskim, a husband can do what is necessary to help his wife when she is sick and anida. But again, he should wear gloves if he needs to touch her directly, if there needs to be any direct contact. Shani, you want to add anything?
Yes, if I may just add that obviously there's a difference when a woman is halachically what's considered a chola sheyesh basakana, and when she is literally in a life-threatening situation, which generally poskim apply today, for example, in the 3 days after childbirth or after any major surgery. So certainly after a lumpectomy, after a mastectomy, and for those definitely the first few hours after surgery until the woman feels that, or the doctors even say that she's out of danger at that point, during the time that she still has the status of a chola sheyesh basakana, we know that not only are Isurei Durabanan can override, but for the sake of Pikuach Nefesh, the Oraitot, such as the Harchakot, even of Negia. So if the woman literally cannot necessarily, after a mastectomy, move her arms, get up from the hospital bed. So again, this would be a state where the woman is in the hospital, which, as we know, certainly after surgeries for treating breast cancer can certainly take place. So under those circumstances, the husband may in fact help her get in bed, out of bed. At the same time, as Cindy mentioned, those are actually settings where very often you'll find other people around as well, nurses and doctors and family members and assistants. So just in terms of being extra halachically sensitive, if it's unclear, obviously better to ask someone else. If the woman feels during that time, even psychologically, emotionally, that she needs specifically her husband, then that would be allowed. The reason why, as Cindy mentioned, and afterwards, when she returns home, at that point, she's no longer generally in the state of chola sheyesh basakana, and therefore, these hatirim, these allowances, aren't necessarily put in place, in which case, again, they become very subjective, and once again, certainly worthwhile to consult with a yoetzet halacha, a rav, a halachic authority, to see what room there is, and both in terms of what types of harchakot, what types of touching would be allowed when, as Cindy mentioned, should the gloves be used, b'chulei, keeping in mind that yes, the emotional, the psychological state is taken into account as well. Okay, Hindi, back to you, or back to our classroom, waiting for questions from everyone. Okay.
Okay.
Hindi?
Do you hear me? Because I look frozen from my end. I'm fine?
We hear you very well.
Okay. Sorry that I'm frozen from my end. I don't know if you can see me normally. Okay, I'm going to throw in a very different type of question, which we're also going to post for Shani. Again, not the standard halachic question, but a question often also that's very important in this time. I'm starting cancer treatment next week. Are there any special tefillot I can say, particularly Prakim with Tehillim? This again is a time that it's great for a woman to take this time and maintain and build her relationship with Hashem. Shani, what advice do you have?
Thank you. Thank you once again, Lindsay. And the advice, there we go. The advice that I generally offer to women in such a case is firstly, tefillah. This is a wonderful outlet at all times, but definitely when one is going through personal trials and tribulations. So even to spend some time with, whether it can be what I call even informal, spontaneous, Maimonidean tefillah. The Rambam says that a woman fulfills the deoraita of tefillah even by mentioning a little bit of shabach, bakasha, hoda'ah. So definitely in the bakasha section, and this can be at any time during the day, to literally spill one's heart before HaKadosh Baruch Hu. In addition, again, through formal tefillah in Rifa'inu. On one hand, we know that Kol HaMitpalel Ba'ad Chaveiro Na'anet Tchila, definitely to mention other people who are sick as well, and put oneself into that category. And this is obviously a very personal question, how much people want others to know that they're going through the challenge of breast cancer. One of the advantages of sharing is not only for the emotional catharsis, but also to have other people daven for you. And there is a special koach, special strength. Certainly, again, the more people davening, the better. So much so that we generally encourage people to continue davening, even for years after remission, right? Just until, most poskim will say, until about 7 years or so, until you really get a clear report. But as long as you're still undergoing some type of treatment, again, it's worthwhile to continue with the tefillot. So in Rifa'inu, in Shema Kolenu, as we know before the closure of the bracha, to mention this as well. And there are, as Cindy mentioned, again, particular tehillim that are said specifically when one is sick, and important to know this. And I, Baruch Hashem, had the zchut also of going to different rabbanim who recommended saying certain mizmorei tehillim, which I think is important to recognize. Tehillim Chaf Gimel, again, Mizmor LeDavid Hashem Ro'i Lo Achsar, is one of the basic mizmorei tehillim that is said at least once a day when one is sick, recognizing that Hashem literally is our shepherd. Tehillim Perek Kuf Chaf Aleph Avshir Lamalot Asaynai El Harim. Me'ayin Yavo Isri. I can't tell you how many times throughout my treatment I must have said this. Tehillim Perek Chaf Lamanatech Mizmor LeDavid Yancha Hashem B'Yom Tzara. Hashem, who answers on the day of my distress. And then, and after each of these mizmorim, to add a special Yehi Ratzon, to add a special short tefillah for the actual statement, Hashem, please, in the zchut of these tehillim, and to be able to merit a refuah shlema. It's also customary to give tzedakah, and both in one's own merit, if one is undergoing any type of illness, definitely for others as well, and to have a shlichim, to ask other people to give tzedakah on one's behalf. And in addition to these 3 standard ones, for any of you who are actually writing this down, there's also a minhag in Mizmor Kuf Yutet 119 that has 7 psukim for every letter of the alphabet, to say the psukim that correspond to one's name together with the name of one's mother. So there are also a Hasidi custom, and therefore I'm going to mention this now, is that there are those who actually recite 36 different Pirkei Tehillim, some of which I mentioned. So I'm going to, for those writing this down, Perek Chaf, chapter 20, chapter 6, chapter 9, chapter 13, 16, 17, 18, 22. I already mentioned 23, 28, 30, 31, 32, 33, 37, 38, 39, 41, 49, 55, 56, 69, 86, 88, 89. These are the Mizmorei Asaf that are said particularly in times of distress, of national trouble: 90, 91, 102, 103, 104, 107, 116, 118, 142, 143, and 148. Now, sometimes I'm very wary, and I said these very quickly, because at times I'm actually very wary of saying all this, because when people hear 30 different Mizmorei Tehillim, that's a lot to say on a daily basis. I say it doesn't have to be daily. It can be what comes to mind. Tehillim, like tefillot, are also meant to be spontaneous expressions of emotion. And therefore, to start even with the basic Mizmorei Tehillim, with personal tefillot, with the Yehi Ratzon, and definitely with Rifa'inu and with Shema Kolenu. So, Hindi, thank you for that opportunity to share that outlet, that emotional outlet, and definitely that religious outlet of expression.
Thank you, Shani. Shani, if you don't mind, maybe this next question, we're going to start with Rachel and me. If you can maybe write them down, if you want to put those Prakhmat Tehillim in the chat.
Definitely will.
Okay, thank you, Shani. Okay, so I'm currently under, again, reminder, we want to hear from you. So if at any minute you think of a question, please let us know. Okay, here's another prepared question. I'm currently undergoing chemotherapy. I need to use the mikvah, but I'm nervous about the mikvah's hygiene, exhaustion that will affect preparation, and immersion at night. And I stuck in a bunch of things here, and I'm nervous perhaps also about the mikvah attendant seeing me without hair. Again, these are just a bunch of random concerns, but they're all very, very real concerns that a woman might have in using the mikvah at such a difficult time. And I want to start, if possible, with our doctor. If she can give us maybe a little bit of it, I've spoken to different doctors about this, and I know that there isn't one opinion about cancer patients, and obviously it has to be patient by patient. But what can you tell us, Rachel, about a woman who is undergoing chemotherapy using the mikvah with regard to the hygiene question?
So I'll even address this even more broadly, because I think the mikvah question deals with chemotherapy, deals with the surgery experience, as well as the radiation experience. Right. So the most obvious thing to say is you should be consulting two people, your rabbi and your physician, and together come to an understanding. But as a general rule, if the skin is intact and you're using, a modern normal mikvah, these are safe places, your skin is intact, and usually there aren't concerning issues. When you have open skin from recent surgery, if you have raw or open skin because of some radiation side effect, if you are significantly immunosuppressed with mouth sores or any opening, then I think those are specific questions that should be addressed again with your physician and your local Orthodox rabbi. But short of that, we now have ports that are subcutaneous, intact skin, chemotherapy. If you're immunosuppressed but you don't have any open skin or wounds, a mikvah immersion experience should not be an issue that I'm aware of.
Thank you so much. Thank you. So I'll address just some of the other questions here, and of course, you always have to consult with your personal doctor, like Rachel said. But in terms of some of the halachic stuff, I'll give you just some basic information. Number one, like Rachel said, you need a modern mikvah. Thank God, one of the silver linings of COVID is that a lot of the mikvahs have upped their game when it comes to hygiene, and you should make sure that whatever mikvah you have access to is keeping up with those practices, that it is actually, properly chlorinated or brominated or whatever it is, and that the room is cleaned properly before you use it. A woman who is immunosuppressed should definitely get a chance to use the mikvah first before anybody else in the night. And, that can be done in consultation with whoever runs the mikvah. This is something that they do for not just for cancer, for all sorts of women that have medical concerns. Often the mikvah can accommodate them to give them the cleanest possible experience at the mikvah. That's number one. And then if your doctor does give you the okay, there are just a couple of other details that I want to mention. Number one, single dip in the mikvah is permissible. We have customs. Most people have the custom of dipping 3 times. That is only a custom. It is not an absolute requirement. And in such a case, if a woman really, wants to get in and out and have as little exposure as possible, 1 dip is permissible. There are some who suggest that you would need Hataras Nadarim for that. Our posek Rabbi Alman does not think you need Hataras Nadarim for a temporary change in your minhag practice, but of course you can consult with your local posek on that question. One thing to consider also, this woman is concerned about exhaustion. Definitely when you're thinking of preparation, don't leave everything for the last minute. There are lots of things that can be done in advance. The only things that should be done very close to the immersion are, again, that last good rinse off, and it could be in a shower if a bath is uncomfortable for whatever reason, that last rinse and that last combing of the hair. But other things can be done hours in advance. And it's also important to know that for a woman that is suffering from exhaustion, which could be the case, it is permissible in many cases to use the mikvah during the day. That would need to be arranged, personally. You need to call the mikvah and make sure that they'll open for you, because mikvahs are usually closed during the day. But there are circumstances where a woman just feels nights are very exhausting and overwhelming. And if a woman feels that going during the day would really make her experience so much more comfortable, that is something that you should discuss again with your posek, with your mikvah, to see if they can accommodate that for you. It's really something that can be helpful. If you ever do immerse during the day, it's important to know that there is a minhag not to have relations until night, but that as well is something you can discuss with your posek in extenuating circumstances. Perhaps that minhag can also be foregone if needed. Like I said, you can adjust your preparation. If you're, dealing with sensitive skin, you do not need to take a shower. I'm sorry, you do not need to take a bath. You probably need to shower, but our poskim do consider the possibility of even using something like baby wipes. So again, if there's a particular area of your body which you really can't stand standing under the shower with, keep in mind that the goal is to get clean. Your hair really is the main thing that should be washed and combed, but other parts of your body, perhaps you can think of other creative methods like baby wipes to make sure that your body is prepared and clean and you remove any foreign substances from your body. I'm looking back at the question if I skipped something. Oh, the last question. The mikveh attendant, that's a really important thing. And this is also something that I think is a good thing. We've seen some change, recently with regard to COVID. The mikveh attendant halachically has one real responsibility, which is to make sure that when you immerse, you're completely under the water and not even a hair, as they say, sticks up out of the water. That's her primary job. Mikveh attendants over the years have taken on other jobs to help us check our nails, to help us check our back. Those things are not essential. And a woman can be given privacy when she needs it. The mikveh attendant can remain outside the room until the woman is completely, until the woman is basically, submerged up until her neck. And the mikveh attendant can just quickly take a peek in, when the woman calls and says, I'm ready. Another option, which is important to keep in mind, is that if you don't, feel comfortable around the mikveh attendant, hopefully mikvahs would be okay with you choosing your own attendant, maybe your sister, maybe your best friend. All you need to be an attendant is to be a bat mitzvah, and you can potentially consider choosing somebody that would make the experience more comfortable for you. If even that is challenging and you really need more privacy, you should consult with a posek. You can consult with the Yoatzet Halacha as well. And there are times where we would permit a woman to immerse with a very loose net around her hair. Because again, the main issue with having somebody watch you immerse is that your hair might stick up out of the water. So with a very loose net that has no elastic, you kind of cut the band that those nets come with. Sometimes it is permissible to immerse like that. And a woman also who actually has lost her hair, a woman who has very, very short hair, sometimes there may be room to immerse like that as well without an attendant, but that would need to be kind of considered on a case-by-case basis. But just realize that you can ask these questions. Realize that there are things that you can do. Discuss it with your local posek or Yoatzet Halacha to try to figure out, how to make the experience as comfortable and as least stressful as possible. Know that there are some options other than the standard way that we go, on a regular month.
Candy, I just wanted to add, because sometimes I also work as a mikveh attendant, and often as a person going to mikveh, we don't realize the breadth of experience that mikveh attendants or physicians. So both physicians and mikveh attendants are very used to seeing people's bodies. And you might not realize that they see women with tattoos, with amputations, with after mastectomies, with no reconstruction, women without hair, women who have alopecia having nothing to do with chemotherapy. So just to remind you that this is very normal for them. Sometimes it's empowering for you, for the patient, to just say, I'm going through treatment. I just want you to, let's say it's a mikveh attendant, and you're concerned about the reaction, just to offer the information in advance, because maybe you're concerned about their reaction. You can control the scenario by just saying, I've had this surgery, or I don't have hair right now. And sometimes for some people that can be helpful if you present that information to the mikveh attendant in advance.
Thank
Excellent.
you.
And if I may just add a little bit, just as Rachel said, again, being in that circumstance, and I'm glad that Hinzi addressed the interaction with the mikveh attendant. Baruch Hashem, many mikveh attendants, balaniot, are being retrained today to be more sensitive. Again, it's very difficult after a mastectomy, either a unilateral, bilateral. Again, the woman doesn't necessarily feel comfortable with her own body. So I just like to add a few recommendations, meaning of different discussions to have with the mikveh attendant, as Hinzi said, with regard to what's called chafifa, knowing that you may be in a state of exhaustion undergoing treatments. And on one hand, you're excited to to finally be able to touch your husband once again. Again, not to realize that Khafifa can even begin the day earlier. You can ask for extra time and patience, even at home, but definitely in the mikvah for preparation and immersion. I would recommend also scheduling your visit to the mikvah for a specific time if you prefer not to see other people, to ask also, keeping in mind that it's also an Eight Ratzon, the time in the mikvah, so to ask for some time alone. This sometimes gets a little difficult if the mikvah lady, by law, sometimes has to be there to make sure that nothing goes wrong while the woman is in a body of water, but still very often will not only turn around, but sometimes leave one alone for a little while to also, ask for a larger towel, ask the mikvah lady to hold the towel at eye level when you're entering the water, to coordinate, again, being the first or after the mikvah has been drained or refilled. And as mentioned before, in terms of tefillot, being in the mikvah is a wonderful time to say the Mizmorei Tehillim, to daven from the heart, not to be embarrassed to ask her for physical assistance. Again, if you feel more comfortable with a family member, again, definitely room to ask for this as well. Again, definitely to prepare also different halacha questions that you may have. A wonderful time, again, right after the bracha on the tefillah, when we say the Yehi Ratzon, for the rebuilding of the Beit HaMikdash, also to ask for these issues as well. So I'm actually going to post on the chat and other tefillot that some people say, specifically in the mikvah, and different poems that have been written for those who want to take a look at this as well. And I'm sure Hinzi is going to get to various chatzitzot that come up throughout the process of dealing with different cancer treatments. So I guess we can go on to the next slide.
Okay, I'm not going in order. I'm thinking about the time and which ones to choose. We will get to at least one or two chatzitza questions, but I was thinking perhaps we would take up the question of tattooing. Now we're going to talk about this question twice, and we're going to put the two together. There are two tattoo type questions that come up for a cancer patient. Specifically, we'll start with Rachel to tell us a little bit about radiation tattoos, and then we'll talk also about reconstructive tattoos. So I'm going to read the question first. Maybe I'll read both questions. I can't decide. And then we'll hear from our doctor, and then me and Shani will talk about some of the halachic issues. So here's our question. I have breast cancer and need radiation therapy. My doctor wants to delineate the area which needs to be treated with tattooed pinpoints. I'm not sure if that's the best language, but again, small dots that are tattooed into the skin. However, she mentioned the option of permanent marker. I'm slightly uncomfortable with the idea of having tattoos on my body, but I am told that they're very small and they will not be very noticeable. Medically, is there a significant difference? Halachically, are these tattoos permissible? Regarding mikveh use, is a tattoo considered a chatzitza? Okay, so let's start from the medical side, and we'll do the question about reconstructive tattoos afterwards.
Perfect. So tattoos relate to radiation therapy treatment, and the goal of radiation therapy is to treat a certain body area, certain anatomical area with significant precision. And tattoos have been historically the most useful, simple, reliable way for a patient to be, we call it reproduced or repositioned in a very accurate way before treatment each day. The tattoos are tiny when these are used. They are permanent when tattoos are used. There's typically 2 to 3 tattoos, one placed in the middle of the sternum on the breastbone, one placed on the side of the chest, and sometimes on both sides of the chest. There are newer technologies they are newer, but they're not necessarily better. They're just different, where tattoos may not be necessary. And I would just encourage anyone who isn't comfortable with tattoos to speak to their radiation oncologist, because they may be very comfortable with using either permanent marker covered with what we call Tegaderm or clear stickers, or some other technologies may be available in certain practices using infrared surface skin imaging to position a patient on a daily basis.
Thank you. Yes, we hope that technology will be available in more places soon, because it seems like an excellent option. But for right now, we know that option is not always available. So just the halacha is simple. If this is something which today it is, medical consensus is that the tattoos, and Rachel, you can comment on this if you want to jump in to add anything, but I think the medical consensus right now is that tattoos are preferable to markers. Do you want to comment on that?
They're just, the issue is that when you position a patient, the tattoo is permanent. So you know you're going to find it. If the permanent marker gets showered off and you need your treatment the next day, sometimes it can be extraordinarily challenging, if not impossible, to deliver the treatment appropriately or safely. And so that's where the challenge comes up from a medical perspective.
Can I add actually one more medical question? Sorry. I've heard some doctors say, and I'd love your opinion on this, that another reason to have the tattoo as opposed to the marker, again, leaving the other cooler new therapies aside, is that in the future, if a woman goes through another cancer experience, it's important to know where the area was precisely. Do you agree that that's also a reason to prefer?
I personally think that's becoming less and less of an issue. I would say 20, 30 years ago, before everything was based on CT planning, three-dimensional imaging, that often was the only way a physician could reproduce or understand what was treated. Today, that's not the case. And so I personally don't think that is it can be helpful, but it isn't, it wouldn't for me be a sell at all as far as tattoos.
Okay, thank you. Okay, so back to just some of the halachic points. As long as doctors look at tattooing here as it's done for a medical reason, it's part of saving a life, and it is still the preferred medical option today, and that might change in 10 years. But today, it is permissible. The mitzvah to save a life overrides other mitzvahs in the Torah, and this tattooing anyways is not a biblical tattoo. It doesn't have any letters or images. It's a simple dot, according to many poskim, that makes it rabbinic, and we can certainly forego it for a medical preference. One thing
sorry, there's as a physician, I get asked this by Jewish patients all the time. I don't know where it comes from. Maybe one of you can answer that. If I get a tattoo, can I be buried in a Jewish cemetery? I cannot tell you.
Sad.
I've been asked that question.
Yes, it's really a misconception, and it's very sad. And the answer is absolutely, you can be buried in a Jewish cemetery. I don't know exactly how these tales came. Shani, do you know where this came from? It's not a halachic issue. You can absolutely be buried in a Jewish cemetery, and I'll stick in the mikveh thing. It is absolutely not a problem of chatzitza for mikveh use. Shani, you want to add something?
Yeah, so just what I've heard is the source of that, just like you said, and not based halachically. Idea of not being buried in a Jewish cemetery was they used to mark with ink the different bodies, again, which one is a Jew, which one not, and therefore it seemed that certain bodies that were marked as non-Jewish, and especially during times of conversion, if someone associated, let's say, with the church, they would mark that body as a church body, so to speak. And then such a person wouldn't be buried in a Jewish cemetery. Today, Baruch Hashem, we don't mark that way. And therefore, it's not about having a tattoo in terms of overriding an Isser D'Oraita, or again, if it's not permanent, again, less obviously not issues of D'Oraita. So it's interesting how historically these ideas develop. But just as Cindy said, and the truth is that Rachel gave the answer without even realizing it, that speaking about different tattoos, she said that are very difficult to come off. If it's a tattoo that you can wash off, which medically isn't as great in terms of precision of surgery, if it washes off, then keeping it on would technically be a chatzitza, anything that can be removed. If it's already part of the skin, as any other type of colorings, and then it's not considered a chatzitza. The Shulchan Aruch actually tells us in Hilchot Nida, Siman Kufta Dechetziv Yitzayin, he says, even what was used for makeup, and this permanent type. Let's say you were dealing with dyes and paints, and you get off whatever you can, and you can't get off the rest, like with a tattoo, then it's not considered a chatzitza for mikvah. And the Rama goes so far as to say that if this is your umanut, in other words, this is your profession, and definitely when it comes to, as Cindy said, again, life-threatening situations, and you're undergoing surgery, there's no greater umanut. This is what you should be involved in at that time. So definitely allowed. More modern posek, the Badei HaShulchan, who says that definitely we can be somech on this, and if she can't remove the tzeva, which is exactly the point, we don't want her to remove, the dye in this case, then it's just like dealing with any other type of permanent dyes that get absorbed in the skin, and therefore it would not be considered a chatzitza. I do want to relate also just to the emotional side over here. Again, going through this as well, sometimes it can be very difficult all of a sudden, in addition to knowing that your body isn't going to be the same. Now you have these markings, and it's important to know, as Hinzi mentioned as well, this is what is, again, they're not really very noticeable, and they do become, again, more part of the skin. And here's a beautiful example of where halacha really does reflect not only the medical reality, but the emotional reality. The point is that this becomes part of who we are, part of the process of taking care of ourselves medically.
I will add that tattoos can be removed by dermatologists with laser therapy. And so if someone has a lot of emotional distress with the presence of tattoos, they can be removed safely.
Thank you. Okay, so we're going to move on to this similar halachic question, but it's important, and it's halachically a slightly separate question. I'm undergoing a unilateral mastectomy and would like to have cosmetic surgery with a silicone implant for breast reconstruction. Am I permitted to do so? May I have a nipple tattoo? So, Shani, you want to take this?
Okay, excellent. Here we go. And so Baruch Hashem, there's plenty. Firstly, the discussion, why this is even a question, right? Someone perhaps may be thinking, but we know that surgery for life-saving reasons is definitely allowed. However, for non-life-saving reasons, it's considered chavala. You're not allowed to, again, perform unnecessary damage to the body. And obviously, any type of surgery is going to cause some type of, even if it's ultimately for the reconstruction, some type of mutilation and damage to the body. Nonetheless, Anna, there definitely is precedent, especially Rav Moshe Feinstein, who wrote numerous tshuvot about this, with regard to psychological needs, especially for the sake of yofi, for the sake of beauty. He wrote, even though he still says it's going to be done through chavala, again, any cosmetic surgery is still going to be some form of surgery. But nonetheless, and he says that because it's going to be done for the sake of not bizayon, she's not doing this to chas v'shalom, mutilate her body, but adraba, it's for the betterment of her body, her psychological, her emotional state, and therefore, again, he says it would be mutar, definitely in the case of breast reconstruction, and many women feel that this is something important for themselves, for intimacy with their spouses. And I actually heard a story of a woman say that, of course, she was going to undergo this because she was even worried that at the time that other women would see her under different situations, again, the mikvah lady, for example, that she wanted to prevent herself from any type of psychological suffering. So this would definitely be allowed as well. And with regard to, and Rav Moshe also talks about, and other types of states like this, but keeping in mind that health also involves definitely the emotional state. To quote Rabbi Yehuda Henkin Zatzal, the Nishmat, one of the Nishmat Rabbanim, and he said that even though there's a Torah prohibition of tattooing, and nonetheless, for breast reconstruction, he says they do not fall under the prohibition of tattooing because they're restorative in nature, and therefore it does not add or even give the impression of adding to what was originally there. So there definitely is sufficient halachic opinion to allow for both any type of breast reconstruction and the nipple tattoo.
Thank you, Shani. Okay, I'm going to move on to another question. This is something that Rachel already alluded to, but I'm going to go into it a little more carefully, and we'll hear, of course, Rachel's opinion. I'm starting chemo soon. I will need a central line to administer it. That's often the way chemo is administered, through intravenously. It is needed for at least 6 months. My doctor recommends a PICC line, but did mention a couple of other options. Does it matter which I choose? Will I be able to go to the mikvah with any of them? Rachel, do you want to start by giving us a little bit of some medical information about some options?
Sure. So if someone is going to have multiple infusions or treatments, therapies that require intravenous access, meaning the therapy is supposed to be directed right through an IV into a vein, it certainly can be done by just introducing an IV into an arm, but there are some situations where either a woman has veins that are hard to access medically, or the drugs that are planning to be administered, specific chemotherapies, it's safer to administer them to a large central vein. So we call it central venous access. And we can place in the operating room either ports or access devices that are either beneath the skin, so that they're completely beneath the skin, or sometimes we do like a PICC line where it's a special IV line that stays in the person's arm or chest permanently, but that there is an exiting component outside of the skin. And that's really a combination of personal choice, discussion with your physician, how quickly or easily you need to have that line placed, and what treatments you're looking to have done. So I would say those are the issues from a medical perspective.
Thank you. Okay, so the one thing, this is a complicated question from a halachic perspective. If you decide with your doctor to go through with the PICC line, the option that is simplest from a halachic perspective, but of course you have to do what is best for you medically, is really a port-a-cath. The port, as Rachel said, is implanted under the skin. It leaves no chatzitza question, zero. And I did discuss with a number of oncologists who felt that for breast cancer in particular, a port is a very good option. But of course, you need to discuss with your own doctor and what they're comfortable with. A port is, something that can be there even longer term. A PICC is often used for shorter term treatments, and the 6 months, obviously each person's treatment is different. But the amount of time that this chemo is usually administered is considered long term. And while a PICC line is a good medical option, many doctors say a port is an equally good. Some say better option. A port is slightly one additional surgical, step for insertion. But after the insertion, it's just easier. You don't have to worry about getting it wet. You don't have to worry about infection as much. Now, if you do get an infection, it's dangerous. Infection with central lines is actually something very common and not to, it's very serious stuff if you get an infection. But which of course, again, anybody that has a central line obviously needs to consult with their doctor if they should be immersing at all. Some doctors would say that a woman with a PICC line should never immerse. Again, the PICC line is the one that is not completely under the skin. So there is an exit site and there is a sensitive spot there that is prone to infection. And the way a PICC line usually works is that we mentioned the word before, Tegaderm. There's a Tegaderm, which is just a brand name, but some type of sticker, bandage, which has medical components as well, antibacterial components. The Tegaderm is placed usually on the PICC line long term. It's changed every week, but it is always there. So the main question halachically with immersion with a PICC line is, what do we do about this Tegaderm? The PICC line itself, according to all the poskim that I've spoke to, the PICC line itself is not a chatzitza problem, but it's this Tegaderm, which is something that is external, which is basically a bandage that is placed on, again, the exit site of the PICC line, which is there all the time to prevent infection. There is a debate among modern poskim if that is considered a chatzitza. On the one hand, you're kind of keeping it there all the time. It's not just to protect you from water, it's to protect you from infection all the time. But on the other hand, it is changed weekly. So it is a complicated question. Rabbi Alman, who I've mentioned a few times, thinks that a woman can immerse. He does not think that immersion with the PICC line and a Tegaderm is a chatzitza. He thinks that it is permissible to immerse, but the truth is not every doctor will even permit that. Normal medical guidelines in a standard, at least in US hospitals, as far as I can see, is that when you need to shower, when you need to get wet, the Tegaderm, they say, you shouldn't rely on the Tegaderm being a good barrier, and you should use an extra wrap, saran wrap, plastic. You're covering the whole area, the whole arm, when you shower, when you get wet, and when you would immerse in a mikvah. So this is a question that if you need to consult personally about. We can't give all the information about this right now. I guess if I had 2 sentences, I would say that if your doctor lets you consider a port, it's easier in the context of mikvah. But a PICC, there are perhaps ways to do it, but it is really complicated from a medical perspective and from a halachic perspective. It's a question that you should definitely ask. There are ways to do it, but not every doctor will allow it. It won't be good for every situation.
It's just such a great example of when it's helpful to ask your Rav or your Yotzat Halacha about the options before it happens. To me, this is just illuminating.
Yes, it's very helpful to be aware before.
Yes, if I can just add, I was trying to post a picture that everyone should try to get online and see exactly what Hinzi is referring to. And this goes back to understanding what a chatzitza is. A midoraita, only if it covers majority of your body and it's something that bothers you. And a midrabanan, even if it only has one of those conditions. What's interesting about the PIC line is that it's miut, it covers minority of your body, and eno makpid, meaning you want it to be on you. It's for your health benefit. And therefore, it's really, again, and even what extends beyond the skin is really more a chumrah of Rishonim and Achronim. And so one should not feel badly at all. I get questions all the time. I have the PIC line. I know that I need this in, but it's clearly a chatzitza. And if one understands a little bit of the development of halacha, then you realize that there's really not a problem. You're halachically permitted to immerse in it. And as Cindy mentioned, with regard to any of the types of wings or any of the types of coverings to keep the PIC line in place, ideally, if one can keep it there for more than 7 days and only replacing it weekly, then to a certain degree, you're basically saying it's part of my skin. But as Cindy also mentioned, very often it gets dirty, it moves, the adhesion wears off, and there are many Rabbanim who say, but your intention was that it should stay there for as long as possible. But again, we're all ending with the common denominator of consult both with your doctor and with your rabbinic advisor as well.
I just want to add one thing, if I wasn't clear. It is in cases where you need to, where your doctor will not allow you to immerse with just the Tegaderm, and you need that extra plastic wrap. That is the most difficult halachic question, because that plastic wrap is very temporary. It is only for immersion in the water. It's not something that lasts and stays with you for any period of time. So that becomes, it is very difficult halachically to permit immersion with that extra plastic. The Tegaderm itself, like I said, and like Shani said, there's a lot to ask. There's what to ask about it. It's still not so simple, and there are some who will not permit it, but many will. Okay, I don't think we have that much time. Does anybody, Shani or Rachel, do you want to choose a question, or should I? Is there a particular question you'd like to wrap with?
So
I think you're doing great, unless Shani does.
I was thinking, Hindi, how about if we show the women the various questions, just so that they should realize how broad this is, and get a sense of the different questions that are out there, just to sensitize them to some of the questions that may come up, such as, again, many, and this is perfect, Cindy, again, when one takes Leukerin or any other type of estrogen and progesterone suppressing hormonal treatment, and generally it suppresses the ovarian function, and the period will become lighter, less regular, eventually stopping entirely. And many of the questions of this satot come up, just like women who undergo any type of hormonal change, whether it's after they go off of Cerazet, the mini pill, or during perimenopause. So what the halachot of satot are always worthwhile to review and to speak to one's halacha consultant. So if anyone has particular questions about any of these, now's your time to ask. Next slide.
Okay, so this is just a standard chatzitza question, which really applies in many areas, not just with regard to cancer, but of course questions of stitches, staples, medical glue. These are of course questions that you should know. It's not a simple answer. You know, the first question is really just for your doctor. Is it okay for me to immerse with this? And the answer might be no. But if the answer is yes, we don't have time to go into all the details, but definitely ask. Don't assume about any of these things that are meant to keep your skin together, whether, again, well, I'll throw out, seems to be a consensus that when you're dealing with stitches that are dissolvable, that is not a chatzitza. But regular stitches, you got to ask some questions. It depends how long the stitches are needed. Similar when it comes to medical glue, there's some debate among poskim. Please consult. These are questions that we are prepared to answer and talk you through. Sometimes it is a very personal question, depending on exactly where you're at and how much longer you need this device.
If I may just add to all these questions, as I'm looking at Rachel and Hindi at the same time, to remember that these are questions, if you know a little bit beforehand, then it's very worthwhile to engage, obviously, with halachic authorities and at the same time with your doctors. Sometimes they're just going to put the glue on, not realizing that there's a difference between the glue and stitches and what type of stitches and dissolvable and when do they dissolve. And and therefore also bring in the medical practitioner into the halachic discussion.
Okay, I put up another question here, which again, we're not going to go into the details, but sometimes a woman might find it challenging to comb her hair when she's losing her hair. The answer to that question is really case by case, so a woman should definitely consult about that. A woman who is planning to shave her head, according to our poskim, that is not a concern. She can still go to the mikveh, even if she's planning to shave her head the next day. This is a really hard question, which can't be addressed in a moment. But of course, there are situations where a woman is diagnosed with cancer and is pregnant. And that is I don't know, Shani, you want to make a comment about it?
Yes. Part of the reason why I put the question is I'm 5 weeks pregnant is because halachically a fetus is not considered a viable fetus until it's 40 days old, right? So at 35 days, again, it's not even considered a viable fetus, which means that one should be sensitive. Again, and obviously, try to undergo testing or whatever it may be, and before reaching 40 days. At that point, and we know that the mother's life is really the ultimate concern. At the same time, also consulting, as I'm sure Rachel has a lot to say about this as well. Again, there are certain types of treatments that won't necessarily put the fetus in harm, but if there is even a suffix, again, that it may put the fetus at harm, then you have to take into account how imperative is it for this surgery, for this treatment to be taking place right now. And therefore, medical practitioners must be brought into this question. Halachic authorities must be brought. We're talking, and especially with controversies going on in North America right now with regard to the issue of abortion, one definitely has to make sure that the woman's health is really what comes first here. And at the same time, there are ways of ensuring that the fetus, and definitely post 40 days, that there are ways of trying to figure out what type of harm would be caused, and perhaps an abortion is not necessary. So to please, as Cindy said, to ask these questions with tremendous caution.
I'll just add that many people may be surprised that not typically during the first trimester, but there are chemotherapy regimens that are very safe and highly effective that can be given during pregnancy, and many people may not realize that.
Thank you. Okay, this one I think Shani already touched on, but marker dots are not a chatzitza. I'll just say it. Okay, marker dots are not a chatzitza. You should not remove them. Chas v'shalom, you should not remove them before immersion. You can reapply them before immersion to make sure that they stay in place. Now, one thing that Rachel mentioned could be a chatzitza. Rachel mentioned that sometimes they cover the marker dots with some type of bandage, some type of tegaderm. That is a real halachic question which you would need to consult about. But if that tegaderm could be removed, the marker itself is not a chatzitza. There are lots of skin questions that can come up when it comes to using the mikveh, especially for a woman who's going through radiation therapy. Now, Rachel, who is an expert in this, told me personally that she has a way of doing radiation therapy and prescribing, creams that really minimize the suffering that can go through without that. So, of course, you could hopefully consult with your doctor.
It's not like I'm just saying that it's not me. There are just newer technologies. There are shorter doses, lower doses. There are prescription creams. Lots of things can be done, and I've just seen a huge change in radiation toxicity over my career.
Which is amazing, because I've heard in the past people really struggling with skin issues. So hopefully that won't be an issue going forward. But if a woman does have sensitive skin issues, she should consult. Okay, and it affects both her mikveh preparation and the question of can she immerse with the ointment. And there are times where the answer is yes. Many times where the answer is yes, but of course you need to know exactly your case and exactly what your ointment is and how long you really keep it there. So please do consult if you have a question about skin, about ointment, about scabs, about again any peeling skin. These are all great questions, and thankfully many of them we can give a good answer to. Many of them we are really not a problem, or really not a chatzitza.
I just want to add that this is something, interestingly, that you'll find different piskei halacha from different rabbanim. So it could be that your friends heard, oh, she can keep her ointment on, and you called your Rav, and your Rav said, no, you should really try to wash off whatever you can. So just know that there is a machloket with regard to what type of ointment, how much is absorbed, and this should be taken into account as well.
Thank you. Okay, should we end with this? I don't know. I have time, but I think our time is officially over. Okay, maybe we'll end with this one. There are women going through cancer that sometimes ask questions about using the mikvah as a spiritual, immersion, not as a halachic immersion. Sometimes, again, a woman may end her cancer experience and not have her period anymore, at least temporarily. And she may ask to immerse, at the conclusion of her chemo, or when the doctor says that she is, there's no evidence of disease. At that point, can I use the mikvah? That's a question that we have gotten. Sean, you want to give a quick thought?
Okay, so again, Hindi and I have discussed this together as well with regard to, on one hand, one does not want to, again, really, I'm even going to say, distort halachic practice. And sometimes what can happen is that when one uses mikvah for spiritual purposes or healing or emotional purposes without it being halachic purposes, again, it's important to keep in mind that brachot should not be said. Again, otherwise it would be a bracha lebatala. Sometimes it confuses women with what's considered a halachic immersion versus what's considered a non-halachic immersion. And that's why there is I just want to begin by saying that there is some reluctance with regard to always allowing a woman, for spiritual or emotional purposes to use the mikvah. That being said, again, there are many rabbanim, and definitely, and I would even say, as women, there are times that we encourage one to use the mikvah also for these emotional, spiritual purposes. Many women enjoy going to the mikvah during treatment, feeling that it adds an element of spiritual or emotional healing to the recovery. And the tzvila, the immersion, can actually be a way to prepare for treatment after a diagnosis. Again, just like it marks the transition from tumah to tahara, from being impure to pure, it can mark milestones in the healing process after surgery or at the end of treatment. It could also be a special opportunity to regain connection. If we view mikvah as the waters of Eden as a means of literally rebirth, then there is a beautiful way of, through mikvah, regaining the physical, emotional, and spiritual self that some people feel that they've lost somewhat through the process of diagnosis and treatment. And therefore, it could also be that the visit to the mikvah can be a meaningful way to say goodbye. Again, for those who are going to be placed even chemically into a state of menopause, it could be a medically induced menopause. So sometimes even a transition because it just came all of a sudden. And others who want to go to the mikvah and say Mizmor L'Todah, to give thanks for reaching the next stage of treatment and Be'ezrat Hashem. And I think that this is a beautiful way to end. Again, to wish everyone a refuah shlema, to realize that Be'ezrat Hashem, we should all be zocha to through the halachic process, to be able to also be able to say Mizmor L'Todah, Nishmat Kol Chai, at the end of one's treatment, to realize Al Kein Ivarim Shepilakta Banu, Beruach Neshama Shenafachta B'Apenu, V'Lashon Asher Samta B'Finu, Hein Hein Yodu V'Yiparachu V'Yishabchu, to recognize that all of our bodily functions and our health come from HaKadosh Baruch Hu, and may we all be zochet to give proper thanksgiving for a complete refuah.
Amen.
Thank you. Thank you so much for joining us. We had a couple other slides, but they actually, some of our topics were addressed by other lectures, other sessions at this conference. Please, if you want to hear more about BRCA testing or about challenges or preserving fertility when a woman is going through cancer, there are sessions that are dedicated to fertility preservation. Please, if anybody would like to contact us, we are all happy to hear from you. All three of us have our email addresses up. Please take them down if you're interested. If you want to ask, again, a more personal question, I know during the session nobody wanted to voice, but maybe a one-on-one would be easier for you. We would be so happy to be there for you and to help you in any way that we can. Thank you for joining us.
Thank you.
Yes, thank you.